So we all know that many people are not happy with the current healthcare system, with the recent sightings of, drug costs going up, insurance premiums going up. People are targeting, big insurance company CEOs because of their backstory, because of their personal experiences with the shortcomings of the healthcare system, the providers, and things like that. So in this video, I'm going to talk to you about the new initiative that is trying to fix all of this and how I am participating and what information you need to know to get ahead and to keep yourself healthy and to keep your loved ones healthy in this paradigm shifting aspect of the healthcare system. Hi, everyone. If you're new to this channel, my name is Dr. Jason Yuan. I teach you about the science of integrative medicine, particularly energy healing, but also adding a twist where we complement and we give commentary to different aspects of health and well being. So it's been a while since I made my last video, but really I wanted to come back and talk to you about the healthcare system because we are starting to see a big shift and a big change because more and more over again, people are coming to realize how toxic our environment is. And if you heard about the recent news of certain food coloring, food dyes being banned finally here in the United States, which have been banned already in Europe and other countries, especially with other things like microplastics and other contaminants that are being leached into our food from our cookware, from our environment. It makes so much sense to why the United States has one of the highest premiums, the cost of healthcare, and the lowest in terms of average health outcomes, right? More people are being sick. Percent of the population is actually metabolically healthy, right? More than 50% of young adults are pre-diabetic or diabetic, right? Or have metabolic disorders like high cholesterol, obesity, hypertension, things like that. So it's really a grim picture. And this has been generated, of course, by more of the, how I would say, insurance companies and big pharma. They have their own agenda, right? And their agenda is for profit. And when you put profit over people, especially over health, which is something that should be universally accepted, universally should be people should strive for on the government, business, private level. This is what happens, right? And we are finally starting to see the information come out saying, all these things in our environment, all these things in our diet, all these things in our cookware, right, are affecting our health in a negative way. So, how do we combat that? How do we fix that? Here comes the new paradigm, which is whole person health. Okay. Whole person health basically is sort of the opposite of what the current healthcare system is, which is, let's say, if you have, let's say, a blood disorder, right? You first need to go to a primary care doctor. Then after your primary care doctor, you would go to a hematologist because, of course, that's you have a blood disorder. Whole person health basically says that your entire body is connected, and everything that you do, everything that you eat, everything that you come in contact to affects every system. So no longer, you, because let's say you have a GI disorder, because you have an ear infection, a throat infection, you have to go to all these separate doctors, which is, yes, it's important. It's important to see specialists if your condition is very severe and chronic. But whole person health basically says that all of our systems are connected. Your GI system, your nervous system, your immune system, your blood system, circulatory system, it's all connected and they each affect each other. So when you fix one area, when you correct one area, all the other systems start to function normally as well. Okay. And this comes back to the whole point of, holistic health, what people call alternative medicine and things like that. And as a naturopathic physician and as a acupuncturist, I've heard the story many times where, mainstream medicine tends to poo-poo, alternative or holistic health because it's not science-based and it's based on, quackery and based on, unproven theories and more, right? Which is the funny part is more and more that the science and research shows that is coming out nowadays that is starting to show that it is so important to be in nature. It is so important to have a clean, healthy diet. It's so important to get sunlight, to get water, to go outside barefoot, to get some grounding, right? So it's funny to me because you cannot beat nature. Okay, nature is really the best medicine, and nature has been around way much longer than we have. And it's something that is so important to recognize because as technology gets more advanced, with AI and all these advancements in medical technology, especially, we're going to be more isolated than ever from being outside. So, whole person healthcare basically acknowledges so many different aspects. So, from your sleep, from your digestion, from your energy, from being in nature, from your diet, exercise, lifestyle, things like that. It's all part of a healthy healthcare system, right? Doctors should be able to tell you, to prescribe to you, hey, not only diet and exercises are important, but maybe get some more sunlight, right? Maybe go outside, get some fresh water, fresh air, go to places that really restore and calm your nervous system rather than being, cooped up at home, working from home in a big city where there's a lot of noise, air pollution, things like that, which is, not healthy in the long run. So, and this is important because I want to say this because as big pharma starts to develop more and more drugs that are, again, with technology, it gets better and better. And yes, drugs are amazing. They have a place in this world. They serve an amazing purpose for many conditions. What I'm trying to say is that in addition to that, we must balance that, right? We must get ahead of that and not just rely on drugs once we get there, right? And this is what preventative medicine is, right? You want to start ahead right now while you're still ahead. Hopefully, you're still ahead, and hopefully, not have to use the drug as a safety net to live the rest of your life, right? Especially if diabetes, metabolic disorders, obesity, hypertension, right? And or any other chronic inflammatory disorder, and how that starts is with you. And we understand this in naturopathic medicine and other integrative medicine modalities, is that your mind and your body are deeply connected, right? And there's a field called psychoneuroimmunology, which basically tells us how you think, how you feel about yourself affects your immune system, which affects every other part of your body. And of course, many people are stressed, many people are chronically inflamed. Their cortisol levels are very high based on the environment that we live in today, based on how society is nowadays. And it is very challenging. And I'm not saying that, if you are in that position, right, I'm not saying that it is something negative, right, that we judge you or I'm judging you. It's just how the cards are dealt. But what's amazing for all of us is that the body is so resilient and the body is programmed to heal. And the body is programmed to heal in such significant, big ways that you wouldn't think would be possible, right? People coming back from very severe ailments like cancer and major depressive disorders and making like a 180 turn. And this is all possible because of having the right information, having the right awareness, and taking the actions to change your life through these protocols, through these steps. And, part of what I'm doing too is spreading the teachings on using this energy medicine that I talk about on my other channels and using this life force energy, which is basically like the battery to your cell phone, to supercharge, to accelerate your body's own natural healing state. I'm attending a conference in integrative medicine in Seattle in March where we will be talking about where we'll have the leading experts in different fields talk about all these different ways of whole person, healthcare coming in and changing the healthcare landscape for the better. And especially talking about, some of these therapies that might be have been labeled alternative, quackery, or woo-woo 10 years ago, but now it's starting to emerge with a lot of data, a lot of science showing that it works. So I'll be there in March in Seattle, and I'll be interviewing some of these bright minds and sharing with you the experience and sharing with you what healthcare will look like in 5 to 10 years, which is very exciting, right? And this all goes back to show that, I believe that the truth always comes out, right? As human beings, we always want to know the truth, right? And you can only suppress us as a species for so long, right? Because as with anything in life, we all continue to grow. We all continue to learn. We all try to be better than what we were yesterday. And as we do that, again, we're starting to learn about all these things in our environment, in our food, right, in our cookware that is toxic and that has really been a burden for so many people. And it's a reason why so many people are sick. And because of that, right, which is not a bad thing, but it's a thing that we need to learn from. Because of this awareness, now we know there are different initiatives, changes to policymakers, like what I just mentioned, banning food dyes and other chemicals and products that should not be in our food to begin with, right? Which were already banned in other countries, which makes no sense. But again, it takes that awareness, it takes that initiative to find out, to figure out what's wrong, to make a stand and make a change and to move forward, right? So I think that's really exciting for all of us because I envision a world where everyone has access to high quality healthcare with solid recommendations with evidence-based science behind it and helping them not live just a healthy life but use prevention, use these different therapies to improve their current health and help them live a happier life because of it. You don't just, there's the age old saying, you don't eat to live, you live to eat, right? And same thing with healthcare. You don't just go to the doctors when you're about to, be bedridden because of your chronic illness and sickness. You want to go to your doctors when you actually need it. And hopefully you don't need it for that sense, because we understand that so many of these conditions, so much of these chronic health ailments can be prevented early on if only we had the right information, if only we had the right tools and therapies in the beginning, which is now coming out now. So that's it for this video. I know it was a little bit longer, but I'm really passionate about integrative medicine, whole person health, along with spirituality and many of the different topics I spoke about. But this is really to kind of set us off. And if you have any questions, any comments, any experiences on healthcare, because it is the topic of this video, and that is my journey and how I got here, feel free to leave it down below. And if you like this video, feel free to like, comment, and subscribe. Looking forward to seeing you all in the next video. Take care.